But some health news now. Guidelines for isolation when someone has COVID-19 may soon be changing. In a report published in the Washington Post this week, CDC officials said 5 days would no longer be the recommended amount of time.
Yeah, it's the first time those isolation recommendations were loosened since 2021. According to the report, the CDC plans to advise using clinical symptoms to determine when to stop isolation when someone is positive for COVID-19. Our Brandon Schaff joins us in studio now to explain how local school districts could respond if those changes happen. Brandon.
Hey, good evening, Rudy and Leslie. The Texas Department of State Health Services tells me that they have no isolation recommendations for the general public other than the standard safe practices, and local school officials explain that their COVID-19 guidelines are in line with the TEA and the CDC.
We haven't actually had any updates to that since August of 2022. So that's the last time that we had received any guidance from those agencies. So that's why that's still the practices that we follow to this day.
Kelsey PQ with Ingleside ISD says that any new CDC recommendations would be passed on by the TEA to their district, and that Ingleside ISD will mirror what the TEA recommends. With almost 2,000 students enrolled there, she said safety for them is a top priority, and the district wants to make sure they're following safety and health guidelines.
So I'm sure that as soon as CDC were to push out any new recommendations, the TEA would follow as suit and communicate that with school districts so we could follow the most up-to-date information.
According to a report in the Washington Post, the CDC's new approach regarding COVID-19 isolation recommendations means people wouldn't have to stay home if they are fever-free for at least 24 hours without aid from medication. They also need to have mild, improving symptoms. We also checked in with Corpus Christi ISD, who shared in a statement that they follow guidance set by the TEA, and that would go for any updates to the isolation protocols as well. The rest of the statement reads in part, quote, "At this time, our procedure will remain at 5 days of isolation from the onset of symptoms or the date of the positive test result. Students and staff may return to campus following the 5-day isolation period with an improvement in symptoms and 24 hours fever-free without the use of fever-reducing medication." Public charter schools like Richard Milburn Academy also said if the CDC changes recommendations for isolation, it could factor into these policies. RMA Student Community Coordinator Rhiannon Garcia said staff there must also wait 5 days and students must be 24 hours fever-free before they can come back to school.
We always try and keep our students and our staff safe. We definitely don't want them here if they're sick. We are a small school, so we definitely will go with the guidelines that they choose for us at the CDC.
And Texas DSHS says that since COVID-19 is still on the list of diseases that would keep kids out of school, they are required to stay home until 5 days after symptoms started. The agency adds that they will be evaluating whether that should change for the next school year, and we will continue to keep you updated right here on 3 News. Rudy, Leslie.